Now to talk about the global vaccine distribution efforts is Lisa Inks with Mercy Corps. Good morning, Lisa.
Good morning.
Thanks so much for joining us. So we're talking right now about some areas that you're concerned about in terms of vaccine distribution in conflict areas. What are some of those areas you're looking at right now?
Well, it's important to understand that, first of all, while people may be seeing images of others getting vaccinated, it's only happening in a handful of Western countries. So in most of the world, vaccine efforts are not yet underway. We are concerned about a few things moving forward as vaccination efforts do go forward. First, we're concerned that efforts could further worsen social inequities, divisions, and conflict, especially in fragile and conflict-affected places. We're also concerned in conflict areas like Iraq and Nigeria, that conflict will deliver a double blow to vaccine efforts. It's going to be very difficult for healthcare professionals and aid workers to safely reach civilians and deliver vaccines. And in those places where governance is already weakened, the public is likely to mistrust public health interventions or just simply not prioritize those given all of the challenges they face.
So in terms of getting these vaccinations to some of these countries, is there one particular country like the United States or Great Britain who is leading that effort?
Well, there is a global mechanism called COVAX, which is a global initiative to ensure that the vaccine reaches those in greatest need. Still, at this point, wealthy countries have bought up enough vaccines to vaccinate their populations, 3 times over, whereas in most middle and low income countries, only 1 in 10 people can even hope to get the vaccine by the end of next year.
Lisa, we obviously, the world is made up of so many different cultures, religious beliefs, political systems. What are some of the challenges in terms of making sure that this vaccine gets distributed to some areas that will really be in need?
Well, we're concerned about a couple of different challenges. One is within countries, whether intentional or unintentional, uneven distribution of the vaccine to, as you said, different ethnic, religious, or political groups may actually spark new tensions or grievances that feed conflict. And misinformation and disinformation is likely to make those perceptions even worse. We also know that while the most clinically vulnerable will be targeted for vaccination, like the elderly, that in some cases the most socioeconomically vulnerable people, like refugees and other groups that face discrimination and marginalization, may be overlooked or even actively excluded from global vaccine campaigns. We just learned, for example, in Colombia that it was recently announced that refugees from Venezuela, which is more than 2 million people, will not be getting a vaccine unless they can present their formal paperwork, which is very few people. So we're concerned about populations like that getting left behind.
All right, Lisa Inks with Mercy Corps. We appreciate your time this morning. Thank you.
Thanks, Lisa.
Thank you so much.